Paul Jones. I'm a consultant urologist at Morriston Hospital, Swansea, and I'm going to give you a 10-minute pre-seed overview of consent, and this is for the Swansea Bay University Health Board induction. So the basic definition of consent is that you have to give consent to treatment before a person can give permission to receive any type of treatment, test or examination. If the person doesn't consent, then in common law this is assault or even prosecutable under the tort of battery. There are three essential purposes of consent. The first is the medical purpose. You have to ensure that the patient trusts you and cooperates with you. This is far likelier to result in a successful outcome if the patient has belief in what you're saying and you've consented them adequately. There is a legal purpose of consent, and that justifies you administering care. Otherwise, it would potentially be considered unlawful conduct. If you were to administer a treatment or perform an operation, then this would be considered battery. It's also very important to consider the ethical purpose of consent, where you respect the person's autonomy and the right to self-determination, regardless of whether or not you believe or agree with that person's beliefs. So the three fundamental criteria for consent are that it must be voluntary. The decision to consent or to withhold consent from the patient should not be influenced by yourself or from undue pressure from patients, relatives, friends, or family. Consent should also be informed. That means that the person should be given all of the relevant information about the procedure or treatment that you're proposing, including the risks and the benefits, and also what would happen if they weren't to receive any sort of treatment. Finally, the patient must have capacity. That means that they must be able to understand the information that you're giving them, they must be able to retain the information that you're giving them, and they must be capable of understanding what will happen if they withhold consent, if no treatment is administered. So in November 2020, the GMC updated its guidelines in this document, which I would strongly urge you to visit their website if you've not seen it already. And they've become slightly more prescriptive in the criteria that are necessary for consent, in that they've stipulated there are 7 components. The first is that the patient has to be involved in the decisions about their care. The second is that the decision making, it must be appreciated as a dynamic process. Just because they've signed a consent form a week or so ago doesn't mean that that is necessarily relevant at that stage. So it has to be something that takes account of an evolving situation, and reconsent occurs as necessary. Patients must be listened to and given all the material information that they need, and you have to have an understanding of what is important to the patient, what matters to them, so that you can attune your consent in keeping with their beliefs and their values. Doctors must start from the presumption that patients have capacity, that they can understand and retain the information. If they don't have capacity, then you must attune the consent form so that it is in keeping with what you think is in their best interests, and involvement of the patient's friends and family is paramount in this process. A patient whose right to consent is affected by law, and they should be supported and involved in the decision-making process and exercise choice throughout. So I'm not going to go through the historical aspects of consent, but probably the most pertinent landmark case in the last 5 to 10 years has been the Montgomery case. And this involved Mrs. Montgomery, who was not consented for the risks of shoulder dystocia in giving a child vaginal delivery in somebody that had high risk, which was diabetes and short stature. She wasn't consented. She didn't have a cesarean. She went on to have a vaginal delivery, which was protracted. As a result, her child suffered from shoulder dystocia and cerebral palsy, and she was awarded £5 million compensation because of the long-term life-changing effects on her child, Sam. The Montgomery case in 2015 was an absolute landmark in that it set the legal precedent to ensure that a doctor has a legal duty of care to warn of all relevant material risks. Material means that a reasonable person would attach significance to the risk, and the doctor needs to be aware of that to that particular patient, and how they would attach significance to it. In other words, you need to discuss all important risks, no matter how potentially small they are, if it is relevant and pertinent to that patient's care. And the GMC guidance has changed a little as a consequence of that. Prior to 2020, the GM guidance said that all doctors must give patients the information they want or need, including the potential risks, burdens, and likelihoods of success. That was modified in 2020 in that they stipulated you should include the following information, but also went on to say about the benefits and risks of any serious harm, no matter how unlikely it is to occur. Now, to many people, that came across as quite confusing, in that knowing what a specific patient requires in terms of information can be very difficult. It is very subjective. Clinicians like facts, figures, statistics, and I would say only a minority of patients want to know even if there is a tiny chance of dying from taking a medication such as penicillin or having a minor operation, and the majority will not want to go to the nth degree to describe any potential tiny minuscule risk. So that's left doctors slightly confused in that, well, are they obliged to disclose any risk of serious harm, even if it is utterly minuscule? And I think the GMC were cognizant of that and tweeted shortly after their guidance was published that our updated guidance is actually less prescriptive. We've changed the wording from must to should usually, and they've effectively entrusted doctors to use their judgment to apply the guidance in proportion to the specific circumstances of that decision. So it is always best practice for the person actually performing or undertaking the procedure to gain consent themselves. You can seek consent on behalf of colleagues who are undertaking a procedure if you're capable of performing that procedure yourself, or if you've got a detailed and comprehensive knowledge of that procedure or treatment as well. Competent adults are entitled to refuse treatment despite that decision resulting in their harm. If they have assessed the information that you've given them and they deem it unnecessary or that they do not wish to undergo that treatment, even if it disagrees entirely with your beliefs, then you have to respect their wishes and conform to those. The only exception to that is the rule where the treatment is for a mental disorder and the patient is sectioned under the Mental Health Act. But all patients aged 16 and over are presumed in common law to have the capacity to consent to their own treatment unless there is evidence to the contrary. Parents or legal guardians must consent for children who are less than 16-year-olds in most circumstances, but it is good practice to involve the child where they have a mature understanding. Children can consent for themselves under the age of 16, and this is called Gillick competency, and they have to demonstrate that they have mental capacity, again, in that they understand and they retain the information and understand the risks and benefits of not having any treatment done at all. But it is always best practice to involve parents and or legal guardians. If the adult is incompetent in terms of giving consent and they don't have the capacity to make their own decision, then it's imperative that you establish if they have a power of attorney, which means that somebody has been appointed to act as their legal proxy to act on that individual's behalf. When you are considering what the patient's best interests are, it's important that you extend your scope beyond their medical interests and include all of their faith, their beliefs, and involve in as much as possible you can the patient's friends, family, relatives in that discussion. Advance directives are where an incompetent patient has clearly indicated in the past, whilst they are mentally competent, that they would specifically refuse treatment in certain circumstances. Regardless of whether you agree or disagree with that, you must abide by that refusal. It is a legal obligation. The doctrine of necessity is enshrined in law, and what that means is that you are capable of administering treatment to an incapacitated patient. And an example of that would be somebody that's, for example, suffers from a drug overdose, or somebody that's been in a severe road traffic accident, and you are capable of administering treatment without their consent, because the doctrine of necessity states that you can do so specifically if it is to save life or limb. There are 4 types of consent form, except in Wales there aren't. There are 3 because consent form 3 is now obsolete. Consent form 1 is by far the commonest use, and those are for people over the age of 16 who have mental capacity and under the age of 16 who are GILIC competent. Consent form 2 is for a person who has parental responsibility for the child and who's not GILIC competent. And consent form 4 is the best interest form. So this is a 16-page document where the patient does not have capacity and you are consenting on their behalf, again with the documented involvement, ideally of friends, family, relatives. So this is consent form 1. The first part, it's important that you include the necessary detail, and if you're using addressographs, do make sure that you're putting addressographs on the second and third sheets of this. The procedure needs to be written clearly in legible handwriting. The type of anaesthetic, any other procedures, blood transfusion potential, including percentage chances of that if that's relevant. You need to state if the child is 16 or over and you believe them to be mentally competent, or if they're under 16 and you believe them to be GILIC competent. The benefits and the risks. It is important and very good practice to include any relevant information sheets. So most of the key organisations, for myself, the British Association of Urological Surgeons, every surgical subspecialty has one, as do oncology and physicians. But any procedure that you're proposing to administer, it is very good practice to give the patient the information sheet to document as such. You need to sign, date, print, and include your GMC number. Specifically on this side, include if an interpreter has been involved and if there have been any advanced decisions to proceed or withhold with any sort of treatment. Quite commonly now, patients are cancelled on the day because there are no beds. You can still retain the same consent form, but you can use the lower part of it to re-sign it on the date of their readmission so that the consent form is still valid. Consent is a very complicated process, and it's not binary black and white. If you're unsure of the particular aspects of a certain patient with a certain consent, always seek advice from senior experienced colleagues. The Health Board has several individuals that can help with this as well, and I'll show you the slide on their contact details. And of course, you've got your professional or regulatory bodies. So you've got your MPS, your MDU, and the GMC. It is critically important that if you are engaging in these discussions, that you document them clearly in the notes with the date and the time, so that if retrospectively you're required to evidence these discussions, then they are clear for all to see. If you've not done so already, I'd highly recommend the General Medical Council website on decision making and consent, which goes into far more detail than I've given you in these 10 minutes. And specific to the Health Board itself in Morriston Hospital, these are the details of the people that you need to get in touch with if there are any issues regarding any parts of governance or consent. Thank you for your time. I wish you well in your new post. Best wishes.